Hi, everyone, and welcome back to Hormone Hackers with your host, Dr. Annette Schippel. This is the podcast where we figure out all the things that have to do with our hormones, kind of how to be your own personal hormone hacker, and in the hopes that you can make better decisions about your own health or who to work with and just kind of all the little stuff. So let's do some hormone hacking. In the last episode, I talked a little bit about the thyroid, the adrenals, and the ovaries, and a little bit about how they're all connected and the regulation of the hypothalamus and pituitary axis, which, basically regulates all our hormones. But I wanted to, kind of remind people before I dive in about the thyroid was sort of that connectiveness between the thyroid, the adrenals, and then the influence really on the ovaries, and a little bit vice versa. So in today's episode, I just actually want to talk about thyroid. And I know that there's not enough time to cover everything. And so I really just want to give the highlights about what it is, what it isn't, what it does, how do we support it, its influence in the body and different ways that we might view it. And, kind of just give us a little bit more info about that's just easily digestible, right? And then, we'll just keep going from there. So the thing about the thyroid is always kind of think about it. It's a very simple gland because all it does is produce thyroid hormones. It doesn't produce anything else. Now, having said that, these thyroid hormones are incredibly important for, I would say, our overall feeling of well-being, homeostasis, if you will. But of course, it is responding to the rest of the endocrine system and also influencing the rest of the endocrine system. So I do think one takeaway should always be that no gland is a standalone. No gland works alone. No gland has, only one influence or only influence upon itself. So kind of keep that in mind no matter what we do or no matter what we talk about. We oftentimes hear, if my thyroid's off, it's usually someone looking at the TSH. And as I previously discussed, that is just a signal coming from the pituitary. So it could be in response to a stress response, or it could actually specifically be about the thyroid. Now, as far as thyroid hormones, we have T4, T3, reverse T3, and then there's also T2. Nobody really knows what T2 does. Maybe we'll find that out at some point. Maybe it's another way to act, as a reservoir, if you will. Predominantly the thyroid, about 90% of thyroid production is of T4, very little of T3, about 10%. And then most of our free T3 is converted in the liver, about 60% of it. But we do have conversion sites everywhere else in the body. And that conversion pathway relies on selenium. It's a selenium-based enzyme pathway, which is probably also why the thyroid actually stores a lot of selenium. So it's a really important nutrient to make sure that we have plenty of for proper thyroid hormone conversion and function, right? I always tell people, if you're not allergic to nuts, just eat 2 to 3 Brazil nuts a day. That's honestly the best way to get it in. And sometimes, if conversion isn't great and there's plenty, there doesn't seem to be necessarily big nutrient deficiencies, we can always support the liver, because that's where most of it happens. But we also just think we got to have really, really healthy tissue. Now, one thing about the thyroid is that 1000% requires iodine. It stores iodine, requires iodine to make thyroid hormones. And I do think iodine has definitely been given a bad rap through time, probably because nobody really wants us using iodine because it's very cheap, very inexpensive, and it would kind of fix I don't want to say it fixes everything. That's not a true statement, because even though the thyroid needs iodine, it also needs what we call symporters. And symporters are nutrients that help iodine get into cells and tissue for its own function, right? So we still need the B vitamins. We need zinc, we need selenium, vitamin A and D, we need iron, we need all the good stuff to support that. But if we just kind of keep in mind that the thyroid gland, which has the largest blood supply of any of the endocrine glands, stores a significant amount of iodine. And what I said about the blood supply is because your blood passes through it about every 17 minutes. Your entire blood in your body is going to pass through that thyroid gland. Now, what's important about that is if the thyroid gland is iodine sufficient, it is part of our immune system, because iodine is kind of anti whatever you don't want. It's antimicrobial, antiviral, antibacterial, I already said that, anti-parasitic, anti-heavy metal. I mean, if anybody has ever been in the hospital, you all know that you get slathered with like a 10% beta iodine. Now, granted, that's a lot stronger than what's in your body, but the fact that we already know that we can put iodine on us as a way to keep us from getting any kind of infection, things like that when you're in the hospital, I think that's pretty important. So sometimes not enough iodine will result in hypothyroid. Sometimes hyperthyroidism is going to result in lower iodine status. And long before there was any drugs, basically iodine was utilized for any thyroid condition. If you were hypo, you were given iodine. If you were hyper, you were given iodine. And it was kind of, I think, I always think about the fact that the body wants to be well. So if we give it the nutrients that it needs, it's going to correct itself, right? And that's probably a little bit oversimplistic. And, certainly we live in a much more toxic environment. But we get exposure, probably more exposure now than ever before, of things that actually displace iodine in the body. Chloride, bromide, fluoride. Those are like the three big halogens that will actually displace iodine. And I kind of feel like, it's those excessive exposures, compromised detox pathways, which is, kind of leads us to be getting just a little bit sicker all the time. There are times where people are born with congenital hypothyroidism. That's not as common, and it will be detected very early on. It's just been my experience that, usually the fatigue, the weight gain, the hair loss, some of the things that people think of for thyroid can be they might be mistaken. It could actually be the adrenals, but it could be the thyroid as well. So I just kind of always think about, well, why isn't it doing its job? It only has one job to do. It doesn't go through puberty. It doesn't go through menopause, but definitely all these other hormonal imbalances certainly can impact that. So I do think it's important to not just jump in with, I think with thyroid medication, of course, without seeing what we can do to improve the overall health of the thyroid gland, because it is so resilient. And that's kind of a beautiful thing about it, and when the signal says, hey, we need more thyroid hormones, and clearly the thyroid's not doing it, then make sure the nutrients are present. And not only are the nutrients there, but this is where you got to have strong digestion to be actually, to actually be able to absorb those nutrients. Otherwise, it just doesn't work very well. So that's one aspect of it. And I would say that probably the most common condition is hypothyroidism. And to be fair, that is something that's usually earned over a very long period of time. You're more likely to, if something was going to happen abruptly, high stress, different things like that, this is usually where people get into hyperthyroidism. Now, sometimes for women postpartum, it can kind of go either way. Some women will flip into hyperthyroidism after they have a baby. I would say probably more often than not, it'll be hypothyroidism, and that I think is going to tie into hormone, reproductive hormones shifting, and certainly what's going on with the adrenals at that time. Now, when you're looking at the true definition of hypothyroidism, they will define it by elevated TSH and low free T4. That's generally what they're going to look at. And part of that does make sense, because the hypothalamus and pituitary are most sensitive, or the hypothalamus is most sensitive to the T4. So if there's not enough T4, it sends a signal, for to the pituitary to increase TSH, so we make more thyroid hormones. And then we have to be able to convert to free T3, which is the active thyroid hormone. When I say active thyroid hormone, that means when we think about things that are good about the thyroid or make us feel good, it's coming from the free T3, not the T4. Now, unfortunately, when there's a lot of stress, instead of converting to free T4, we will actually start converting our thyroid hormones to reverse T3, which is inactive. I always kind of feel like it's a way to kind of put the brakes on. Now, if it was hyperthyroid, then that would be shown by elevated T4 and also very, very low TSH. Now, keep in mind, both, and a lot of times in hyperthyroidism, it's pretty common. You're going to see elevated T4 and elevated T3. Sometimes, and kind of like conversely too, on hypothyroidism, low free T4 and low free T3. Now, I do see people where their free T4 is still normal, but their free T3 is lower than it should be. And that's kind of going into, well, are we converting? Is this a liver issue? Is this a digestion issue? Is this a nutrient deficiency? But if they're traditional doctors only looking at TSH and free T4, it kind of gets missed. And I will always say, regardless of how the thyroid got in trouble, to have the best overall outcome and vitality, you have to support the thyroid and the adrenals together because they're like each other's ride or die. So you cannot leave one out. Now, what is autoimmune? And I know I'm really going through all this fast, so just bear with me. But I think the idea is that this whole series that I'm doing with Hormone Hackers is that everything just builds on itself, and there'll be repetition, right? So what is autoimmune? Well, the autoimmune component is looking at antibodies, and we can have, TPO antibodies, thyroid peroxidase antibodies, and we can have TBG, and we can have TSI. Those are the three more common ones. Usually that is driven, usually I think it's driven by a virus. It usually comes post-viral, but there could be some other components that are allowing these antibodies to happen. The thought is that the TPO antibodies attack the thyroid gland and are going to destroy it. I have to say, clinically, I don't see that. I don't see anybody's thyroid gland getting destroyed. But I do think that where the antibodies are elevated, there can still be this circulating inflammation stressor for the immune system. Like, come on. And it's just not taking care of it. I have seen antibodies come down and even go into normal range, but I would say that is not a traditional point of view. Most endocrinologists, actually, once they diagnose you, they will not look at your antibodies again, typically. I think it's important because I think it lets us know how the body's healing and, what's happening. There are some antibodies that are more specific to hyperthyroidism, which is known as TSH or TSI. But what I think is, and that's only for hyperthyroidism. So you'll never see that with hypo, but you can have positive TPO antibodies in both hyperthyroidism and or hypothyroidism. So TPO antibodies are positive in both. The most common for, hypothyroidism, which is known as Hashimoto's, versus, and Graves' disease, which is hyperthyroidism, it's going to be more common to see the TSH antibody, or it might be called the TSI. And then you can kind of check in on the TBG, which is more common in Hashimoto's, but I know it's a very small percentage in Graves. So the thing I want to say about that is you can have antibodies, you can have elevated antibodies, and you can still have picture perfect thyroid function. And I mean optimal. I equate that with, I'm not sure that I love the analogy because it's kind of a dark analogy, but it's kind of like having HIV, like you're HIV positive, but you don't have AIDS. So you don't have the autoimmune deficiency syndrome that is AIDS that comes from HIV. And so it's kind of like when you have the antibodies for the thyroid, but you still have normal thyroid function. It's like it's brewing, and it probably is like one stressor, one bad virus or something like that away from having that tripped into it. But it doesn't have to be, right? It doesn't have to be. And that's, the goal is obviously to help the body be well, right? And the immune system to do its job properly. Not all situations with autoimmune are an overactive immune system. Sometimes I will see where the immune system is underactive. And also, there can be other things going on with the immune system that involve, and then the thyroid gets involved. So sometimes even when you're looking at, you're looking at a thyroid panel, you have to put it in context with the person. If you have someone who's really sick or is getting sick and maybe they don't know it yet, like they're not symptomatic, but they've got pneumonia brewing or whatever it is, their thyroid will set off the alarm bells, just like the adrenals will. You will see something that looks really crazy, and yet it's not like they're presenting with thyroid symptoms, either way, hypo or hyper. And that is something that I have seen in my practice. And, when it shows up, it's actually rather alarming, because you're like, oh, holy hell, what just happened here? And then it's usually like they get sick within a week or a few days later of those lab results, which also means, and this is actually pointed out in endocrinology textbooks and so forth, is that you shouldn't make a diagnosis of a thyroid condition when someone is sick, because that's like making a diagnosis of something going on in the immune system when someone's sick, when the immune system is just doing what it's supposed to be doing. So I do think there's a lot more to learn and understand about what goes on with the thyroid. I would say my first really big thyroid case, this is, I don't even know how many years ago it was, actually was hyperthyroidism. And I think that's the one where everybody gets kind of scared about, probably because it feels really awful if you have it. And I think the best way to describe it is you feel like you are coming apart, falling apart from the inside out. Your thermostat's broken, your emotional sensor's broken, you don't know whether to cry, you're irritated, you don't feel good, you got palpitations, tachycardia, you got all this stuff going on, and it does feel very, very awful. Traditional treatment, though, is to either give you a drug that basically slowly destroys the thyroid gland until you're hypothyroid, or they will do a radioactive iodine treatment to destroy the gland, or just simply remove it. And, I do believe you have choices, but I also think you have to do things that feel best to you and not do things out of fear, which means if working with someone like me brings you more fear, don't do it. But I think it's important to explore all your options, because there's lots of things that we can do. There's certain herbs that are very specific for hyperthyroidism. And of course, you still need all the same nutrients, that you do for hypothyroidism, right? So that's just kind of like one little like sidebar of that. And when we're talking about autoimmune, I think it is really, really important to kind of dig down and kind of find all the roots leading into the autoimmune. I'm going to say it's usually not just one root cause, it's a root system, meaning there could be chronic inflammation, there's gut issues, there's a viral load, there's poor stress response or a lack of resiliency in the stress response. So it is actually way more complex, and we have to look at, are there toxins, are there chemicals, are there things that are interfering with that? So when you are approaching, holistically something that has to do with autoimmune, whether it's thyroid or something else, then, there's a lot of pieces to look at. Now, as simple as the thyroid is, the fact is, you can't live without it, right? So if the thyroid gland is taken out, then, there's, you're going to be on thyroid medicine, the rest of your life. And they'll try to figure out how to make it as balanced as they possibly can. And it's okay, right? It's okay. If you don't have it, then, you need that, but it does get a little tricky. And usually the best results are going to come about when you are also supporting the adrenals. And I'll just kind of keep reiterating that. Now, if you have Hashimoto's, and that is, so that's where the gland is not functioning as well. You've got hypothyroidism, usually depicted by a low free T4. Sometimes your total T4 is still good, but low free T4 and low free T3 or poor thyroid hormone conversion. And then if it's Hashimoto's, you have the positive antibodies. So on one hand, you're dealing with that. And then on the other hand, you've got to deal with, okay, how do we get this gland, back up to snuff? So it's all the nutrients for sure. If it is hypothyroidism, a very specific herb that's trophorestorative for the thyroid gland is bladderwrack. You don't ever take bladderwrack because you think you're tired or you think that's your symptom. Don't do it. You got to do it based on testing, because again, what you might think is thyroid could be adrenals, but bladderwrack is trophorestorative, and it actually naturally contains, like an organic source of iodine that's very, very bioavailable, which makes sense because you got to have iodine for the thyroid gland to function properly. So I can see why, nature would make a plant that is, restores proper health to the thyroid gland would also contain iodine. There are some other herbs that are really helpful. Probably one of my favorites is as a really good ashwagandha. And the reason I love that is that not only does it improve the production of T4 and T3, it supports the conversion of T4 to T3. And then on the other side of it, it really does support the adrenals. So it supports normal cortisol, normal DHEA, sort of balancing that whole circadian rhythm. And I don't know where recently I've had questions come up when I'm teaching that there seems to be a buzz about that you can't take ashwagandha if you have hypothyroidism, which is absolutely ridiculous. You would 1000% want to take it. And I don't know. I sometimes wonder the more popular an herb becomes, two things. It gets more misunderstood. There's probably a drive I think there's certain things out there, maybe like big pharma and places that really don't want us to be truly well because, think about if we were all well and had no issues, they'd go broke. But some of this stuff about ashwagandha that comes out just drives me nuts. We're saying that it's a nightshade. It's not a nightshade. It doesn't contain solanine. So it has to contain solanine to be considered a nightshade or to cause problems. But it is like probably single down one of the best herbs, especially if you're really not sure what to do. And you could actually even use this in hyper because it doesn't have the same direct effect on it. It just, herbs have an innate intelligence that I don't think we even will fully understand. But because you could have more elevated cortisol in a hyperthyroid case and lots of stress, this is where ashwagandha, would also be beneficial as well. I think the thing, though, then I just have to say this, and I've said it before, is that I cannot speak for other companies. If you're just pulling stuff at the vitamin shop off of Amazon or different places like that, I can't speak for it. I can't tell you if they're using the right part of the plant. Can't tell you if it's been adulterated. I can't promise you that all ashwagandha is equal. In fact, I know it's not. So you could have heavy metals, you could have different contaminations, which can actually make you feel worse. And then that just sort of feeds into the idea like, oh, it was really, really, really bad for me. A couple herbs that also support hypothyroidism in a much weaker way is bacopa and also coleus forskolin. So those are a couple other herbs that do support the thyroid. And I know we'll see like lemon balm, we'll see things like tyrosine. I'm just more of a fan on one. I'm going to pick the things that have the most research to back them up and are going to get me the best results the quickest, but doesn't mean that these synergists are not a bad idea. And just, thinking about anything that has protein, if we eat protein, we get our complete amino acids, and this is going to help us, make all our hormones, in particular our thyroid hormones. So kind of on that side of it when we're looking at that. Another thing that's kind of interesting is sort of nuances that we could see. And I'm going to circle back to the iodine as I finish up this particular podcast, but I did want to talk about cholesterol. I don't think people understand their cholesterol. In fact, I know they don't. I know the majority of people do not understand it and its role. So the thyroid does have a role in how cholesterol is synthesized. And in fact, elevated cholesterol like 240s, 250s, and elevated triglycerides, maybe like the 200s, 220s. And I say that where the other, diet factors and maybe other hormonal factors are not playing a role. This was a really early indicator that could be a state of hypothyroidism or trending towards hypothyroidism. In fact, way back in the day, that was how a vet could determine if an animal was going hypothyroid. I thought that was really cool. On the flip side, low cholesterol, like less than 165, triglycerides less than 70, can be a sign of hyperactivity in the thyroid and or the adrenals. So you can even just kind of looking at your lipids, and I think what I love about that is our body gives us all these clues, right? All these different clues about what's going on and what it's trying to do before it ever gets in trouble, right? we want to always catch things. I mean, if you can catch something early on, it's so much easier to turn it around. Kind of imagine if there's a boulder. Okay. Well, whatever size rock you think you could stop about 5 feet into a roll or 10 feet into a roll. So you want it to be pretty big, but you want to be something that, you could stop. Isn't it a lot easier to stop it about 10 feet going down a steep hill versus once it gains momentum and it's been, rolling and getting faster, 100, 150 feet down, whatever, and you're trying to stop it, you're going to get run over. And that's kind of where I think of, our wellness, our journey to wellness shouldn't wait. Really and truly, I mean, I sometimes have felt too like, gosh, I wish I had known what I know now back in my 20s. God, wouldn't that have been amazing? The choices, well, I mean, unfortunately, our frontal cortex isn't as well developed, so we might not make better choices. But if we can do things for our wellness earlier on, man, we can save ourselves a lot of grief. Because when you get squashed by the boulder, I mean, sometimes people get so broken, there's not enough money to buy it back. You can be the richest person in the world and you're not going to be able to buy your health back. I will say I find that in my 20 plus years of doing, holistic nutrition, doing holistic endocrinology or restorative endocrinology, however you want to think of it, I love that it seems like in the last few years, I have younger and younger people reaching out to me. And I think that's fantastic. I'm in their 20s, just wanting to be so proactive. I will say this, though. I do firmly believe while it's great to catch things before you're in trouble, it's never, and I mean never, too late to do things to be better, feel better, and live better. You just have to take those first steps. You have to find the right individual to work with, and change can happen. I'm just going to end there on that note. And then when I come back for the next episode, I'm going to talk about the thyroid a little bit more, because I really want to touch on the iodine piece and how much it's misunderstood. But then I'm going to start talking about the adrenals as well, and kind of remind us of the synergy between those two glands, the thyroid and the adrenals, but, looking at some things that we can do there too. All right. Well, thanks for listening. I hope you enjoyed this. If you did, give it a like, give it a follow, give it all the things that you're supposed to do. And I will see you next time.